I am by the name Ekakoro Frederick Etori. I am a youth activist, a youth leader, a writer, a researcher, and as well public speaker. I have spoken before a number of audiences. I have written and presented so far 3 research papers on areas of youth empowerment, women empowerment, and youth unemployment as a threat to national development. Pertaining to sexual and reproductive health care services, family planning, and rights of people to access sexual and reproductive health care services, especially the young. There is a lot so far in Uganda that is to be done. Uganda's total population lies at around 34 million people, and the youth make around 27 million of them. However, the youth are the most affected as far as access to sexual and reproductive health care services is concerned. Among those are youths with disabilities who suffer double consequences and actually triple discrimination, especially women with disabilities. You realize that the state of our medical facilities, the personnel in healthcare provision is limited and do not have the knowledge to deal with persons with disabilities. This automatically cuts away persons with disabilities from accessing sexual and reproductive health care services. In many communities, persons with disabilities are sterilized without their consent, and the government so far, even with all the laws in place, has not done enough. This is only depictive of the worst situation in Africa out of all the third world countries and the developing countries, and for instance, and probably other countries in the world. As a young person who has been engaged in youth advocacy and sensitization, in 2009 I was a lead facilitator with Mela Youth Development Club that was partnering with a number of organizations such as Plan Uganda, the AIDS Support Organization, to bring services closer to the young people. And I realized that there is a lot as far as sex education is concerned, that in many families, parents do not talk with their children on these issues. Even in schools, such topics are not discussed due to our cultural beliefs, our religious beliefs. In the same way, our cultural and religious beliefs also hinder access and use of sexual and reproductive health care services. For instance, the Catholics and maybe the Pentecostal believers say that to use a condom is murder, and therefore they do not advise the Christians to resort to such methods of family planning. This has led to a rise of unwanted pregnancies, unwanted abortions, and also death of people who indulge in such abortions. Therefore, there is a lot to be done. Thank you.